over 30 lectures and you are done. Good for you. Good for you. You've made it through by watching all the lectures. Hopefully you've followed along. You've made some flashcards. You've printed out the supplement materials. And hopefully by now you are sick of the work so much by now that you just have it second nature. It's embedded in you. If not, this is a video course and you can watch it as many times as you need to. Regardless, you've made it through and you should be proud of that up to this point. I wanted to do this lecture just to really kind of give you a congratulations, but also to be able to just reinforce some things that maybe you could study on as you get ready to take the exam. Hopefully by now you've signed up for the technician certification exam and you've been able to, you have a date in mind already. Whenever you do, before you do, the night before, I want you to get a good night of sleep, and then if breakfast suits you well in the morning, go for that and go ahead and get breakfast the next day. But going up until that, I want you to really work hard on the material we've covered. We started out with pharmacy workflow, which probably won't be too much on your exam, but then we jumped right into pharmacy nomenclature, and you learned what QD means, what BID means, what QOD means, QW, all those. Once you know that, you were able to move on through to the next sections. Go over those again if that's what it takes. You probably have a pretty good idea of pharmacy nomenclature since that's one of the easier ones to learn. But those SIG codes are definitely the heart of what you'll need to know. Without knowing those, you won't be able to proceed on the exam. After we did that, we went into drug nomenclature, where we were trying to learn the top 200 medications, and then we tried to use the prefixes and suffixes to be able to learn them a little bit differently that way. Hopefully by now you know what the suffix of pril means. You know what the suffix of olol means. How about the prefix of ceph? Look back at those, know all your prefixes and suffixes. That will get you most of your drug questions correct just by knowing those. Look over your top 200 medications again and know them backwards and forwards. Know their brand name, know their generic name, and know their use. Knowing medications is something that's very important to you as a technician. It will help you to be a better and well-rounded technician. And then we moved on into the one that probably scared you the most from the beginning, pharmacy math. Yes, it can be kind of difficult. If you know your algebra, you probably did pretty well with it. We learned how to do allegations. We learned how to do Roman numerals. We learned how to convert percentages to decimals and decimals to percentages. All of those are very, very important tools, but the most important was those ratio and proportion questions. The ones where we've said if we have 500 milligrams per teaspoon, then how many milliliters will we need if we look for 200 milligrams? Be able to figure out those type of questions. They're very important to know. They're very important to be able to figure out and then be able to convert between one to another. It's extremely important you do both in your exam and just you as a technician in your career. So be able to do those conversions, the factor label method, however you can do it, but definitely be able to do the conversions. Then we wrapped up just into how to get a job, how to give out a proper interview, and then of course I encouraged you to get a resume. Also, I mentioned this way early in the class, but I really mean that. If you can get a job in a pharmacy right now as a clerk, meaning as a cashier in the pharmacy assisting other technicians, please do so. You'll be able to jump right in and probably get you a technician position as well. It's the smart thing to do, and I really, really, really recommend it. If you can get a job in a pharmacy as a clerk right now, go and do it. You'll have a leg up on the competition whenever it comes to getting a technician job. That's about it. Look over these lectures again and again if that's what it takes. Look over the supplement material if that's what it takes. Study the material hard. You'll be able to do great on that technician exam, and then you'll be able to start your pharmacy technician career. We'll see you.